Hello, my name is Tiffany Chikumu, and the article assigned to me was Wearable Technology. The program was done at the University of Pittsburgh. There was 471 adult participants. It lasted from October 2010 to October 2012, and the data collection completed December 2014. The hypothesis for this program was compared with a standard behavioral weight loss intervention, a technology-enhanced weight loss intervention would result in greater weight loss. Participants were placed on a low-calorie diet. They were prescribed increases in physical activity, and they were also assigned group counseling sessions. Within the first 6 months of the intervention, they added telephone counseling sessions, text message prompts, access to study materials on the website. Participants initiated self-monitoring of diet and physical activity using a website. The results for this program, they used a randomized control trial. It was measured over 24 months at 6-month intervals. The primary hypothesis tested change in weight between two groups at 24 months. The secondary outcomes were body composition, fitness, physical activity, and dietary intake. 74.5% of participants completed the study. Weight loss was significantly less. Both groups had no significant improvements in body composition, fitness, physical activity, and diet, and there was no significant difference between the groups. Now we're going to talk about the 6 components. The first one is objectivity. Methods and procedures adequately were described. Data presented to support conclusion. Methods used to control bias. The second one is internal design validity. Sufficient information provides credible description of subject. Data was collected across the full range of appropriate settings, times, and respondents. The third one is threats to statistical conclusion validity, unreliability of measure of change of outcome indicators, diversity of the population, inaccurate effect size estimation due to outliers. The fourth component is construct validity. Only one level of the treatment is studied. The fifth is external validity. Programs operate differently in different settings. Sample does not cover the whole population of interest. And the final one is utilization. Findings provide guidance for future action. Evaluation had an influence on future project designs, and actions taken actually help solve local problems. There were quite a bit of problems that I found in this program. Benefits achieved at long-term are not fully sustained long-term. Preventing or minimizing weight gain following initial weight loss. It was limited to only young adults. The device was worn on the upper arm, which limits effectiveness. Commercially available, so the researchers had no control over the additional information that was added on the websites. Dietary intake was assessed using self-report. Participants were, it was left up to the participants to log their diet and their physical activity. Participants dropped out due to pregnancy or moving. There was a bit of a bias found in this. Data lost to follow up were not missing at random. A few recommendations I have for this program was to expand the age group. Because they focus only on young adults, results cannot be generalized to other ages. So if they wanted to do this for a younger group or an older group, they would have to kind of redo the whole thing. The device should be worn on their wrist. With the device being worn on the upper part of the arm, the results can be inaccurate, so the effectiveness is very low. So studies do show that it's actually better to wear it on your wrist. Limit any chance of bias. It was found that assessment staff were aware that the participants were there due to a weight loss trial. So because of that, they felt that there was some bias in the program. Here's my reference page. And that will conclude my presentation. Thank you.